This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about trigger point injections. If you like this video, we put out new content weekly, so please like and subscribe. So trigger point injections, what are they? They're basically an injection of lidocaine and corticosteroid, usually, into a specific muscle that causes the muscle to relax. Or what I tell my patients, it goes muscle from doing this and it causes it to relax. There's different... It's more of an art than a science, to be honest with you. So a lot of the injections are given like in joints, like to a tendon, to very specific areas, right? Trigger point injections aren't really doing that. You're kind of giving them to the point where it hurts the most. The idea being that that's where the muscle is most knotted up, and by you injecting fluid in there, an anti-inflammatory and some numbing medication, you can calm that muscle down. And the muscle, and we don't really know exactly how it works. There's ideas on it. I mean, the muscle, when it's locked and won't let go, it creates a lot of metabolic byproducts. And the idea is injecting that into that will cause the muscle to release, and also the anti-inflammatory product of the steroid will cause inflammation to relax. Again, like I said, more of an art than a science. You don't really need imaging for this. It's mostly by feel. At least that's how I do it. I tend not to go crazy with my trigger point injections. I'll do most one on each side of the neck. Some people will do about a dozen or so. I find those don't work as well because I don't think they're targeting the exact spot. They're just kind of going everywhere it hurts. When I see someone who does that, I just don't think that it works as well. But that's really it with trigger injections. There's not much to it. Some people will just use lidocaine. I think it works better with a very small amount of steroid. You could do PRP. I think that's kind of a nuclear option and not kind of unnecessary, but I think some people do it. So I hope I was able to answer your questions about trigger point injections. Actually, let me finish with this. How long do they last? It just depends. If you inject it in a certain area and it relaxes the muscle and you get therapy and really keep it loose, then it might last indefinitely. But if they're only lasting a week or two, then there might be something deeper going on more than the muscle that needs to be taken care of with some other treatment. So again, I hope I was able to answer all your questions about trigger point injections. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.